Oftentimes people ask, why donate a kidney? We don't realize how much the kidneys do for our health until they begin to fail. The kidneys maintain the water balance of our body, helps regulate our blood pressure, maintains bone strength, filters waste out of our blood system, regulates the acid-base balance and electrolytes, and helps with the production of red blood cells. People who have kidney failure can be treated with dialysis or a kidney transplant. These treatments are not a cure, however, most patients who receive a kidney transplant experience an improved quality of life and an extended life expectancy. This is a textbook picture of the normal kidney anatomy. An abdominal CT scan or CAT scan will be completed during the donor evaluation process. This CT scan will focus on your kidney's anatomy, the renal arteries, renal veins, and ureters. During the donor evaluation process, many tests and procedures are performed, such as blood tests, EKG, abdominal CT scan, and an evaluation with the transplant team members. The transplant team consists of a nephrologist, which is a kidney doctor, a surgeon, a social worker, who also serves as an independent living donor advocate, a donor coordinator, who is a registered nurse, and a dietitian. Once the initial testing and evaluation is complete, the transplant team will meet to discuss your donor evaluation. At the committee meeting, the team will decide the status as a potential kidney donor. The decision may be that you are a suitable candidate and that you can move forward with donation, or more information is needed for the committee to decide, or donation is not in your best interest. To make the decision regarding potential donation, the transplant team carefully reviews your testing and considers how donation will impact you physically, socially, emotionally, and financially. Your information as a potential kidney donor is kept confidential and is only discussed with you. If donation is not possible for you, or if you choose not to proceed, we can send a letter to the recipient informing them that someone was evaluated as a kidney donor on their behalf. This letter does not contain any health information and will only be sent on behalf of the donor with your permission or if you request it. The United Network for Organ Sharing, or UNOS, is the organization that regulates all transplant centers in the United States. Some of their rules and regulations are listed on this slide. UNOS requires that organ donors have their blood type confirmed on 2 separate occasions, that organ donors give informed consent for their donor evaluation, that we obtain consent for the HIV testing, that a public health risk questionnaire is completed, that we have a signed release of information, and that all transplant centers follow up with their organ donors at 6 month, 1 year, and 2 year post-donation. This follow-up can be completed locally and the results sent to the transplant center. It is important that we do hear from all of our kidney donors at the 6 month, 1 year, and 2 year mark to make sure that they are continuing to experience a good quality of life. This is an example of the Public Health Risk Questionnaire. This is discussed with all potential organ donors and the living donor advocate. If a patient answers yes to one of the listed questions, a second consent will be completed for donation. There are 2 types of transplant options. Organ donations come from deceased donors or living donors. Deceased donor organs come from patients who sustained a brain injury that they cannot recover from, or from patients whose family chooses to take them off life support. Living donors are people who volunteer to donate one of their kidneys for transplantation. This slide compares the differences between a deceased kidney transplant and a living kidney transplant. On average, patients who receive a living kidney transplant will experience a longer graft or kidney survival time as compared to a deceased organ transplant. In addition, the wait time is shorter for a living organ transplant, and the operation procedure is planned in advance. However, both transplant options offer improved survival for the kidney recipient. When comparing the different treatment options for patients with chronic kidney disease, on average, living donor transplantation offers the best patient survival outcomes. There are different paths that lead to a living kidney transplantation. Direct donation is when a potential kidney donor wants to donate their kidney to an intended recipient that they know. Indirect donation, the kidney donor and the recipient are both blood type compatible and tissue type compatible. Paired donation is when the potential kidney donor cannot donate directly to the recipient because they are not compatible. Paired donation matches an incompatible donor-recipient pair to another incompatible pair. In this example on the slide, Alice wants to give to Andrew and Bill wants to give to Betsy, but they are not compatible. Once in the paired program, Alice is found to be compatible to Betsy and Bill is found to be compatible with Andrew. All 4 patients would have surgery on the same day, and the kidney recipients would receive a compatible kidney transplant. Another program we have is called the Compatible Paired Donation Program. This program is used to find a more suitable kidney for transplant for the kidney recipient. For example, this program is offered when there is a large age difference or a gap between the donor and the recipient. Non-direct donors are those who wish to donate their kidney, but they do not have an intended recipient. The non-direct kidney donor enters the paired donation program, and their donation can result in a chain of multiple donations and transplants. Non-direct donors complete the same evaluation as other living donors. In addition, non-direct kidney donors are required to meet with the U of M clinical psychologist prior to their donation.
When our evaluation team is considering an individual for living kidney donation, their safety is our primary concern. It's important to understand that at any point during the process of the evaluation, that if our evaluation team feels that it would not be safe for that potential donor to proceed, any testing that is scheduled would be canceled and the evaluation would be closed. Our transplant team does not allow individuals to donate their kidney if they feel that their future health will be at risk after donation. This is even true if you're wanting to donate to somebody that you care about or love. The donor evaluation team and the recipient evaluation team are kept separate during the entire evaluation process. This is to avoid any conflict of interest that could impact the decision regarding the donor eligibility. The number one focus for our evaluation team is the donor safety. The transplant team will determine who can safely donate their kidneys through a stringent and rigorous evaluation process. There are medical issues and conditions that have to be carefully considered to ensure that these things would not lead to problems after surgery. Things that we will be looking for is obesity, high blood pressure, tobacco use, drug and significant alcohol use, and any personal medical problem that you have will be carefully looked at to ensure that you will not have any problems after donation. High blood pressure is the second leading cause of kidney failure. So we have to carefully evaluate every potential living donor for high blood pressure. If you have high blood pressure and you are under the age of 50, you will not be a candidate for living kidney donation. If you have high blood pressure and you are over the age of 50, then we will have to carefully evaluate you and there will be further testing required. If you are not aware that you have high blood pressure and you come into our office and your blood pressure readings are elevated, we will request additional blood pressure readings from previous providers that you have seen, and we will ask you to do a 24-hour ambulatory blood pressure monitor. If you're under the age of 50 and that results come back showing that you have high blood pressure, then you would not be able to proceed with living donation. If you are over the age of 50 and the results come back showing that you have high blood pressure, We would then request that you see your primary care doctor and begin treatment for high blood pressure. Once you have begun treatment and your blood pressure is under control and stable, then you could contact our donor office again for reconsideration to be a living donor. For somebody who is at the age of 50 or older, they have to meet all of our standard criteria for donation. They have to have a body mass index, that's your height and your weight together, of equal to or less than 35. They can only be on one medication to control their blood pressure, and we'd like to see their blood pressure at 130/80 or less. The additional workup that we do is to make sure that they do not have any damage to any other organs in their body related to the high blood pressure. These tests include an echocardiogram or ultrasound of the heart and a fundoscopic eye exam looking at the eyes to determine if there's any damage from the high blood pressure. If either of those tests show that there is damage to the heart or the eyes, then that individual would not be able to proceed with living kidney donation. The 24-hour ambulatory blood pressure monitor is to determine what the average blood pressure is over the 24 hours, what it is while you're awake, and what it is while you're asleep. And with that test, we can determine if we think that you have high blood pressure and if your medication treatment that you're on is treating it. If an individual does proceed with donation, they would have to have insurance at the time of donation, and they would also have to sign an informed consent and agree to follow up with Michigan Medicine and the primary care doctor after donation. We evaluate all potential donors for metabolic syndrome. Metabolic syndrome is a cluster of different conditions that, when those occur together, they can increase an individual's chances of developing heart disease, stroke, and diabetes. The concern here is the diabetes. That is the leading cause of kidney failure. There are 5 things that we will look at to determine if somebody has metabolic syndrome. We will evaluate their blood pressure, we'll evaluate their blood sugars, we'll do a waist circumference looking for excess body fat around the waist, and we do a lipid panel. We look at the triglyceride level and the HDL, which is the good cholesterol. If there are 3 out of 5 of those factors that are in the abnormal ranges, then that individual would be diagnosed with metabolic syndrome, and they would not be a candidate for living donation at that time. We may request additional testing to determine if somebody has metabolic syndrome based on their body mass index, based on lab values that we have obtained, such as their glucose level or their hemoglobin A1C level, if those are in the abnormal ranges, based on personal medical history and family medical history. The additional testing would be a 2-hour glucose tolerance test. If an individual is ruled out because of metabolic syndrome, typically we will request that that person lose weight, and in the process of losing weight, the conditions that they had should improve. If that occurs, then that potential person can contact our office back for reconsideration. We do ask for a waiting period once an individual has lost weight before they actually undergo the surgery. This is to ensure that this is a lifestyle change for the person who has lost the weight. Our concern is after donation, if somebody develops metabolic syndrome or has increased weight again, that they will be at increased risk for developing diabetes, and we do not want to see that happen after an individual donates their kidney. The waiting period typically is 6 months to 1 year, but the final decision would be determined by our evaluation team. All individuals coming forward for living donation do have to have a body mass index of less than 35 to be considered as a potential living kidney donor. The transplant team will not allow just anyone to donate their kidney. Stringent screening is required, and potential donors normally have a lot of questions about their eligibility and how donation will affect their health in the future. Living kidney donation is incredibly selective and safe process. Our focus is on choosing the optimal donor for your recipient. So the match or compatibility is not the only determining factor when we're deciding if you'll be able to proceed with living donation and if you'll be able to directly donate to your recipient. Our program is going to emphasize that the focus is on the health of the kidney donated rather than the compatibility. In some cases, even though you are compatible with your recipient, we may recommend that you go through our kidney paired donation program to find a healthier kidney for your recipient. An added benefit of going through the kidney paired donation program is that more than one recipient would receive a kidney transplant. The complication rate after kidney donation here at Michigan Medicine is about 7%. The majority of the complications are minor, things like bloating, nausea, fatigue, shoulder, and back pain. A lot of this is from the anesthesia that you'll be receiving during the surgery, the pain medications that you'll receive during surgery and after surgery. The shoulder and back pain can be related to the length of time that you are on the operating table, the position that you're on the operating table. It can also be referred pain because this is a laparoscopic procedure. Fatigue can be caused by many different things. It can be because of things that start before surgery that could cause you not to be sleeping well. You could be anxious before surgery. You could have depression or anxiety that leads to you not being able to sleep well. The fasting before surgery, we're asking you not to have anything to eat or drink before surgery. That can lead to fatigue as well. Blood loss during the surgery could lead to fatigue. Medications that you receive, such as pain medications, could lead to fatigue. Your body is going to become stressed with exercise and strenuous activity right after surgery. So that can lead to fatigue as well. Normal overall aging and medical problems that an individual has could lead to fatigue and can be enhanced after surgery. This fatigue can last for several months before an individual is back to their normal energy level. You may have to give your body time to heal and have to ease back into your activities, and your routine may have to be restructured until you feel that you are no longer fatigued. If you are concerned about the amount of fatigue that you experience after donation, please contact our living donor office to discuss this further. More serious complications can be treated and rarely have long-term effects. These are things like wound infections, urinary tract infections, pneumonia, blood clots, pulmonary embolism or a blood clot in the lung, and damage to your abdominal structures. After surgery, you will get up and out of bed and be moving around and walking probably that first day. That is going to help to prevent blood clots. It's going to help keep your lungs open, help to prevent pneumonia. And you'll also be taught to do coughing and deep breathing, which will also help to keep your lungs in good condition as well. The damage to the abdominal structures is because of the surgery itself. And the incisional hernia, that is an area of weakness at the incision site that can occur. When this occurs, typically an additional surgery is required to repair that. Oftentimes, incisional hernia will occur because an individual may do an activity that is too strenuous too soon after surgery. There is always a risk of death with any major surgery. For living donors, the risk of death from the surgery is very low. Living donors undergo careful preoperative testing and evaluation to make sure that they are healthy enough for surgery. The risk of dying from a complication of the donor operation is 1 in 3,000. This comes from a study of over 80,000 living kidney donors, and that rate has not changed in the last 15 years. Almost all of our donors will undergo a laparoscopic procedure. Laparoscopic procedures are done because they're a minimally invasive approach, and the advantages are that they will have a shorter recovery time, shorter hospital stay, smaller incisions, and fewer complications after surgery. The operation for the living donor generally takes 2 to 4 hours. The living donor generally is in the hospital for 1 night. Although donors will remain in the hospital as long as they need to after surgery, depending on how they are recovering and feeling. A living donor will anticipate some pain after surgery. We will give pain medications to help with this discomfort as much as possible. However, we will not be able to get rid of all the pain that an individual will be feeling. We do an abdominal wall nerve block while you are in surgery under anesthesia. What this does is it will numb up your abdominal wall area, and it lasts about 24 hours. And this has led to individuals not needing to use as much of the narcotic pain medications to control their pain. which then decreases the side effects from narcotic pain medications such as nausea, vomiting, and constipation. So it makes your recovery time much quicker. This picture is illustrating several different things. The top picture illustrates how a kidney donor will be laying on the operating table. Depending on which kidney will be removed will determine what side the donor will be facing upward. The picture on the right illustrates what a laparoscopic surgery looks like. This picture is not exact for living kidney donation surgery. However, there will be a wand-like camera that is passed through a small incision in the abdominal wall or stomach, and this is going to be used to view the abdominal cavity. The other instruments and tools are used to perform the surgery. The last picture shows the incisions or the scars and where those will be and what those will look like. There's a 2 to 4 inch incision. This is where the surgeon will place their sterile gloved hand to hold the kidney while operating. The other 2 incisions are made to one side of the abdomen, and that's where the instruments are used in the operation and placed through. These scars will fade over time, and you can put a revision cream to help minimize the appearance of the scars if you would like to. However, we ask that you do not put anything on the incisions until they are well healed, and that is to avoid any potential infections. The donor kidney is going to be implanted on either the right or the left side of the lower abdomen of the recipient. It is surgically connected to the nearby blood vessels in the recipient. The recipient's kidneys that are in place, or their native kidneys, are usually left in place unless they have concerns like pain or discomfort, recurrent infections, bleeding, or the kidneys are too large and causing discomfort, or there's not enough room for the transplanted kidney that's going in. Every living kidney donor is carefully evaluated by a living donor social worker. There can be potential psychosocial risks of a donation. Our social worker will discuss all of these concerns in more detail with all potential donors when they are seen in the evaluation and determine if there are any identified risks that could lead to problems after donation. An individual may have problems with their body image after donation. They may have problems adjusting after surgery, may have anxiety or depression. The feeling of emotional distress and bereavement can occur if your recipient experiences complications, rejection, recurrent disease, or in the event of their death. And there could always be a potential impact that living donation has on your own personal lifestyle. After surgery, when you're ready to go home, you will be discharged with some prescription medications. These will include a stool softener and pain medications. As long as you are taking narcotic pain medications, you should take your stool softener. One of the side effects of narcotic pain medications is constipation. And oftentimes, if an individual develops constipation, that pain can be worse than the incisional pain that you have from the surgery. Donors do need to take some time off of work after surgery. Typically, we ask for a donor to take 4 to 8 weeks off of work depending on their occupation. In some cases, non-active workers may return to work sooner. If you have individual questions about when you would be able to return to work, you can talk with the surgeon when you see him during the evaluation. We ask all of our donors to return to the clinic for a post-operative visit about 10 to 14 days after surgery. We ask our donors to stay within a 3 to 4 hour radius of the hospital after surgery as well until they're seen at that post-operative visit. We ask that our donors do not lift more than 10 pounds for at least 6 weeks after surgery. So that's like a gallon of milk. We ask that our potential donors do not drive until they're seen at the post-operative visit as well. This is even if you are no longer taking any narcotic pain medications. We want to make sure that you can make quick decisions and that it is safe for you to drive. After the normal 8-week healing period, you can resume all your normal physical activities. And there will be no restrictions on any of the activities that you would have at that point. For long-term care, we ask that you drink plenty of fluids each day, a minimum of 2 liters, mainly of water. And that's something that even if you don't donate your kidney, that is recommended to do just for your own health. We ask kidney donors to avoid using over-the-counter and prescribed non-steroidal anti-inflammatory medications or NSAIDs. These are medications such as Aleve, Motrin, ibuprofen, naproxen, Advil, Indocin, and Celebrex. These medications, when used on a long-term basis, can lead to kidney damage and kidney failure. If you have a condition that requires you to take chronic NSAID medication, this would be something that you would need to talk to your provider about and determine if your treatment could be changed. After donation, it is okay to take NSAID medications on a short-term basis, less than 3 to 5 days in a row, for conditions such as a toothache or a backache or a sprained ankle, something like that. We ask that all of our potential living donors have a primary care doctor that they will see yearly for general health maintenance exams. This exam should include a check of their blood pressure, their weight, and blood and urine tests for kidney function. You should remind any potential provider that you see that you've been a kidney donor so that future tests and treatments that are offered can be considered with that in mind. If you do not have a primary care doctor, you can contact our office if you need help obtaining treatment for anything related to kidney donation. Required by UNOS, we will require all potential living donors to follow up with our center at 6 months, 1 year, and 2 years after donation. We will be providing a questionnaire to the donor. We will be requesting labs, blood pressure, and weight. This follow-up can be done locally, and we do encourage all potential donors to see their primary care doctor at each of these visits as well. These visits with the primary care doctor should continue after the 2-year follow-up with us as well, with your primary care doctor. We're going to pay for the labs that you'll be receiving during this 2-year follow-up. If you have health insurance, then the visits with your primary care doctor should be covered by your health insurance, as this is a general health maintenance to have these yearly physicals. If you have concerns about the payment for these visits with the primary care doctor, you can contact our donor office and we can talk with you on a one-to-one basis regarding that. We will be mailing a packet which will also include the Care Following Living donation letter. This letter is going to be provided to your primary care doctor if you have one too. This letter will describe the testing that's required and the follow-up that we do for all of our donors. After donation, donors can expect an average of 25 to 35% of permanent kidney loss. Because of this, we ask that all potential donors do a test called an iothalate test. This is looking at your kidney function to determine if you have enough kidney function so that your body can compensate after the 25 to 35% of permanent kidney loss. We also are asking you to have a 2-year follow-up with us and then continue to see your own primary care doctor because of the permanent kidney loss that you will have after donation. If you are ever told after kidney donation that you are having problems with your kidneys, your provider has concerns that your kidney function is not doing well, we do ask that you contact our donor office to discuss this further. We'll obtain records from your primary care doctor or provider that you've seen, and we'll ask for the lab results as well. We will have our nephrologist review all of the information that we obtain and determine if we have any concerns for you. When we're evaluating a living kidney donor for any kind of dysfunction with their kidney function, we look at the trends of their labs. We're looking at their creatinine level. It's one of the kidney function levels. We are evaluating to determine if they have protein in their urine. We're looking at the trends of their blood pressure. So we're looking at the overall picture of things to determine if there is any concerns for your kidney function. The GFR, or glomerular filtration rate, that's a number that they look at to determine if your recipient is needing a transplant. It's one of the kidney function values. That is not an adequate indicator alone for somebody who has only one kidney. Some providers that you see that may not be used to taking care of individuals with only one kidney may not be aware of this. So for this reason, if you're ever told that you're having problems with your kidney, please contact our donor office. The risks for living kidney donation are based on current studies of chronic kidney disease and end-stage renal disease. So it's important to realize that kidney disease typically develops around the age of 40 to 50 in the general population. Kidney failure typically will develop after the age of 60 in this same population. So a medical evaluation of a younger potential donor cannot predict what the lifetime risk of kidney disease is. There is a slight increased risk of developing high blood pressure and spilling protein into your urine after living kidney donation. Living donor kidney transplant is the most widely studied type of living organ donation with more than 50 years of follow-up information. Overall studies show that the life expectancy for those who have donated a kidney is the same as for similarly matched people who have not donated a kidney. Some studies suggest living kidney donors may have slightly higher risk of kidney failure in the future, but the risk is still smaller than the average risk of kidney failure in the general population. A living donor may be at an increased risk of developing chronic kidney disease if they sustain damage to the one remaining kidney. The development of the chronic kidney disease leading into end-stage renal disease may occur faster as well with only one kidney. If a living kidney donor does develop end-stage renal disease, they would be required to begin dialysis. If they are interested in receiving a transplant, they would need to be evaluated to determine if they're a suitable candidate for transplant. If it is determined that they are a suitable candidate for transplant, they would be prioritized on the National Deceased Donor Wait List. An individual who has donated a kidney, their baseline risk of developing end-stage renal disease is not going to exceed that of the general population for the same demographic profile of that donor. Pregnancy is possible after living donation. We do recommend that individuals wait at least 6 months after surgery before becoming pregnant. For the most part, the risk of complications during pregnancy is no different than that of the general population. Studies have shown prior donors have a higher risk of high blood pressure during pregnancy. This is also known as gestational hypertension and a higher risk of preeclampsia. Women of childbearing ages are not excluded from donation, but it is important to consider if you're at the childbearing ages. We would recommend that you talk with the transplant team about proceeding with donation. We would recommend that you talk with your significant other or spouse, and that you maybe even reach out to an obstetrician to talk with them about pregnancy after kidney donation. Your motivation may change for having children over time, so even if you are not interested in having children now, if you're at childbearing ages, we do ask you to consider this carefully. Again, we recommend that all donors wait at least 6 months after kidney donation before becoming pregnant, and that they have good prenatal care throughout their pregnancy. It is unlawful to provide major financial or other incentives for organ donation. However, you can accept recipient assistance for normal bills and needs. There are also programs available to potential living donors that may be able to provide them with funds related to donation for travel, lodging, and meals. If you have further questions about any of this, please contact our donor office. Our evaluation team is going to be paying for the donation workup, the hospitalization, and the surgery, and then if there were any complications related to donation. It's important that if you're having complications after surgery, that if it's an emergency, you go and seek care and have treatment done, and then contact our office. If there is not an emergency and you're having complications, we recommend that you contact our office first so that we can help make sure that you get the care that you need and that we can help with the billing factors as well. If you do receive any bills that are related to donation, please contact our office or contact the kidney financial specialist at the number on your slide. The Affordable Health Care Act has made it illegal for health insurance companies to refuse to cover a person or charge a person more because they have a pre-existing condition. However, there have been reports from some living donors that it has been difficult to get life insurance, or they are facing higher premiums for life insurance. If something like this occurs, our transplant center can write a letter on behalf of the donor to the company, informing them of the existing data that reports living donors are not at increased risk of developing kidney failure more so than the general population, and they have no substantially greater risks of health problems if they maintain a healthy lifestyle after donation. We advise you to talk to the transplant team further about this, as well as check with your insurance contracts to determine if living donation would affect your policy. You can also consult a lawyer who is knowledgeable in insurance law. We have several resources available for donors. One of the programs that we have is the Donor Peer Mentor Program. With this program, we have previous donors who have donated their kidney through our program, and they have gone through special training, and they're able to talk with you about their experiences that they've had. If you're interested in talking with a peer mentor, please contact our donor office and we will get you in contact with one. There are also several websites available that may be helpful to you as well. These websites have educational information and videos about living donation that will give you information to better understand and evaluate the process, the advantages, and the risks of living donation. There are additional resources available, such as for individuals who use nicotine and smoke. We have a tobacco cessation program. The information is on your slide. We do encourage that all individuals who smoke consider quitting smoking, and it'll be a case-by-case basis whether this will be something that will have to occur in order for you to be able to proceed with living donation. Durable power of attorney is a legal document that enables you to designate another person to act on your behalf, even in the event that you are disabled or incapacitated. If you have a durable power of attorney already, that it would need to be presented to the hospital before your surgery. If you do not have a durable power of attorney, it is not something that is required for this surgery. But if you are interested in having a durable power of attorney, you can talk with your social worker further about this. There is also a website here included, which would give you further information. The following are some important points to remember. Living kidney donor transplant is better than a deceased donor transplant because the length of time that the transplanted kidney will last is longer and the operation can be planned. Surgery is not going to be scheduled until both the donor and the recipient are cleared and ready for surgery. We request that all living donors avoid using non-steroidal anti-inflammatory medications on a long-term frequent basis. They can be used on a short-term basis, less than 5 days in a row. Donors can expect an average of 25 to 35% permanent kidney loss. Donors have no substantially greater risks of health problems following donation if they maintain a healthy lifestyle. And the baseline risk of developing end-stage renal disease for a living kidney donor does not exceed that of the general population with the same demographic profile. Please contact our donor office if you have any additional questions related to donation. And thank you for watching this video.